Now, India reported 1.27 lakh new COVID cases, lowest daily rise since the 9th of April. 2,975 deaths were reported in the last 24 hours. India's second COVID wave seems to have abated just as quickly as it had worsened. Just weeks ago, we were reporting the highest ever daily cases, and now many parts of India are recording the lowest case and death numbers since March. Pandey has this report.
The whiplash of the second wave is showing signs of relief, a sharp fall in cases and deaths. At the peak of the first wave on 16 September 2020, India recorded 68 cases per million population. Cases fell to half of that in 45 days. The peak of the second wave was 8th May, at 284 cases per million, and cases have halved much faster in just 22 days. Haryana, Delhi, Uttar Pradesh, Rajasthan and Bihar are the states showing the fastest fall in cases, with all recording between 55 to 65% fewer cases this week than the week before. Some, like UP, are now beginning to ease their lockdowns. However, in some states, there are questions being raised on the decreasing proportion of the more reliable RT-PCR tests versus rapid antigen tests, and whether people in rural areas are coming forward to be tested despite symptoms. Despite these questions, availability of hospital beds and less stress on medical facilities does indicate a rapid fall in cases. Epidemiologists offer two main theories. One is, the sharper the rise in cases, the sharper the fall. Cases were growing exponentially in April and early May, so the localized COVID restrictions on movement and gatherings thwarted the transmission of the virus in more instances and thus brought down daily case numbers faster at a higher caseload than the same restrictions will do at a lower caseload. But Dr. Jugal Kishore, an epidemiologist at Safdarjung Hospital, does not give credit to the lockdowns.
Mutated virus घूम रहे थे, वो बहुत तेजी से उन्होंने लोगों को इन्फेक्ट किया और ऑलमोस्ट मेरे हिसाब से 80-85% लोगों को इन्फेक्शन हुआ. ये तो सीरो सर्वेलेंस होने के बाद में पता चलेगा कि कितने लोगों को इन्फेक्शन हुआ. तो ये मुझे ऐसा लगता है कि कोई लॉकडाउन का इफेक्ट नहीं, ये वायरस की कैरेक्टरिस्टिक और जिस तरीके से ये समाज में दूर दराज के इलाकों में फैला, वही एक रीजन है.
Testing as well as containment has worked in these 6 to 8 weeks that we have done it. However, it is not a sustainable solution. We have to remember that our vaccination is being ramped up, and by December we hope to have the whole country vaccinated.
Although there is some room for optimism about the fall in cases, there is none for complacency. We are at a critical juncture, and public policy on vaccination and COVID restrictions needs to respond accordingly. Pandey for NDTV.